Aspirin is the best known medicine in the world, but do you know what one of its functions is? It inhibits the enzyme cyclooxygenase. This enzyme produces this substance called prostaglandins that help regulate blood pressure and blood clotting, but affect the nervous system and the blood itself. Aspirin works as a competitive inhibitor of cyclooxygenase, inhibiting the production of these compounds, relieving pain, inflammation, and blood inflow. But this is not the only example of a drug that inhibits the work of certain enzymes. Another example is phenytoin, an anticonvulsant that is administered after brain operations, and that in high concentrations inhibits monooxidase and the release of serotonin and norepinephrine, blocking the levels of electrical conductivity between neurons. Another very common example, and outside of what we have seen, is the group of penicillins. Since this is also an enzyme inhibitor, but unlike most of the drugs that we have seen which inhibit enzymes in the human body, penicillin acts on the enzymatic activity of bacteria, since its main function is to treat infections caused by bacteria. Therefore, this drug inhibits the transpeptidase enzyme that synthesizes peptidoglycan, a copolymer that gives endurance to the cell wall of cells. Without this endurance, the bacteria eventually dies. There is a group of diseases called metabolic diseases, which are hereditary. What they do is that certain metabolic pathways are blocked, for example in diabetes, where the body does not produce enough insulin or has become immune, causing there to be too much glucose in the blood, causing heart problems as one of the main risks. But there are other metabolic diseases where the enzymes play an important role. For example, Hunter syndrome, where the body does not produce the enzyme iduronate 2 sulfatase, called IDS. This enzyme breaks down very complex sugars, known as mucopolysaccharides. These, not being broken down, accumulate in blood, structural tissues, and cells. This damages physical activities and mental development. For many years, the only way to treat this was with palliative treatment, and in some cases, bone marrow transplants were done to give a new source of IDS, but it was in irregular measures with many side effects, and it did not resolve mental deficiencies. That is why one of the newest medicines is enzymatic treatment, that is, using recombinant DNA from a specific cell line, in this case human, to create a specific enzyme like IDS. In this way, many effects for the patient can be reduced, especially in very early cases. There are still many aspects to be improved, since this is an extremely expensive medication, which must be administered intramuscularly once a week, and its production, as well as secondary medication for its supply to the patient, do not meet the objectives of bioethics. This is just one example of how metabolic diseases can be treated in an increasingly better way, since up to now there is no drug that completely disappears the disease, and the problem with this is that they are hereditary. But with these advances, we are improving the quality of life of thousands of people.